Welcome, welcome, welcome to Health Talks. I'm Laura Termini, founder of Natural Organic and Latina Chicanol.com. And today I'm excited to discuss with Dr. Singh the focus of his work, the latest techniques for breast reconstruction. Let me just, oh my God, this is, you are so talented, doctor, that I have to read everything that you do. Please allow me. It's gonna be like a minute, guys. The breast reconstruction would help improve outcomes from breast cancer survivors, both functionally and aesthetically. My guest today is Dr. Singh, Chief of Plastic Surgery of the University of Miami Health System and a professor of surgery in the Division of Plastic Surgery at the University of Miami Miller School. Welcome, Dr. Singh. You have more resume than me, and I've been working for a long time. How are you? Welcome to this live.
Thank you so much for having me. It's a pleasure to be here.
I'm so excited to ask you because, you know, reconstruction, breast reconstruction is something that is always on my mind. But we're going to talk about something that I didn't understand it that much, which is like DIEP flap procedure. So can you please explain what you do?
Thank you, Laura. I'm so happy to be here with you and with your audience. Yes, breast cancer is a very serious disease, and it's a very common one, unfortunately. I feel honored and privileged to be able to care for patients that have been affected by this. And in plastic surgery, we get to make people feel better and look better, and we get to put people back together. So it's a really positive part of their journey through this disease. So I really enjoy doing what I do, and I love working with the patients that I get to work with. As you mentioned, there are a lot of different ways to make a breast after diagnosis of breast cancer and the surgery that's usually required to treat it. In general, there are two surgeries that are required to treat breast cancer. One is called a lumpectomy, where only a small part of the breast is removed, and the other is called a mastectomy, where the whole breast is removed, usually leaving some amount of skin. And it's that kind of the mastectomy that we're going to talk about today, and how we reconstruct the mastectomy. Traditionally, we would put a silicone implant in under the remaining skin of the breast after the mastectomy. And this is a tried and true technique and has been used for decades. And it involves usually starting with what's called a balloon or an expander, where we put a water balloon in under the skin or the muscle, and we stretch the skin out, and then in a second operation, we put the implant in. Now, for a variety of reasons and for so many different people, sometimes implants don't work, sometimes implants aren't the desired choice. So what are some other options? And the other way that breasts can be reconstructed by plastic surgeons is to use the body's own tissues. And we have a word for that. We call it a flap, F-L-A-P, but it just simply means we're gonna rob Peter to pay Paul. We're gonna borrow some extra tissue from one part of your body and move it to your breast to make a natural, healthy, living breast. Now, there are a couple of different options for where we can borrow tissue from. An oldie but a goodie is from your back, and that's called the latissimus flap. But by far, the most popular option is from the lower abdomen. And guess what? There's no surprise, you get a free tummy tuck.
Yes.
And so there's just no way around it, and it's true, and there's nothing wrong with choosing this operation for that additional benefit. So the operation that you mentioned, the DIEP flap, or the deep flap, is the latest advance in using the lower abdominal skin, we can call it the tummy tuck skin, and finding ways to take that tissue and transplant it into the breast to make a healthy, living, natural breast out of the patient's tissue. And then we close the abdomen like a tummy tuck.
Wow. That's a, I was just thinking while you were talking about the emotional toll of a woman, because I'm a woman, who went through hell and then, you know, had the chance and have the chance to reconstruct one of the part of our bodies that is very important, because I remember when I was a, you know, a kid, that I want my, you know, my boobs to be bigger when I was a child. You know what I mean? It's something that is, it's in our brain. I've seen patients of cancer, unfortunately. One of my best friends, a producer, died from breast cancer. So I'm very emotional when it comes to this. My auntie, she's alive, thank God, but she had everything removed. So to be able to have now this surgery and have this, because it's about femininity, it's about feeling yourself in your skin, is a big part of our physiognomy, but our psyche as well, doctor. Am I wrong?
No, you're 100% right. This is not cosmetic surgery. That's one way of summarizing what you're saying. And you know, there's a very interesting history to this. Around 25 years ago, insurance companies would not pay for patients who had breast cancer to then have their breasts reconstructed. They were calling it cosmetic surgery. And that's really, really unfair to patients who have been diagnosed with breast cancer and then had a mastectomy and don't have this opportunity to feel whole because their insurance company is saying it's just cosmetic, when it's absolutely not. It really is medically necessary. It's reconstructive surgery, even though, yeah, in some cases we are using the same silicone implant that we would actually also use in a woman who just wants larger breasts. Exactly. But in this particular case, it's to remake the entire breast, and it's to really help remake the person's identity and make them feel whole. All that being said, Laura, I do want to pause and remember and remind everybody that it is okay if a patient chooses to go flat and to wear their scar with pride. Yes. There's absolutely nothing wrong with that. It's really important to remember that. And I start every encounter with my breast cancer patients who are considering reconstruction, and I remind them, I say, it's okay to wear your scar with pride if you want to. But if you want reconstruction, these are the two ways to do it. One is with an implant, and one is with using your body's own tissues.
Doctor, do you only treat breast cancer survivors, or have you seen, like in your practice, people who, because I've been reading a lot about it, who suffer from implant illness, something that it's been quite famous now on social media, that not everybody develops it, but it's more common now. And now, like the medicine school, the School of Medicine is now seeing this as a focus of reconstructive surgery as well.
Yes, so the idea of breast-associated implant illness, breast implant or illness is slightly controversial. However, there is one disease entity that is strongly associated with textured breast implants, and that is a type of lymphoma or a cancer of the immune system. Wow. Which can occur with textured implants. And for those patients, certainly we have seen a spike in those patients coming to our office to have the textured implants removed. And they can be replaced with a smooth implant, or they could be replaced with the body's own tissues, a flap like we're talking about.
Oh, okay, so you can use the same technique for people who are not sick, but are starting to having those symptoms as well.
Yeah, you absolutely can, but it does get a little tricky when it comes to insurance and who's going to pay for that in particular, because if that textured implant was placed initially for cosmetic reasons, then the patient wants it out. The insurance company may not pay for the flap procedure, which is very, you know, a very technical operation. They may not pay for it in that particular setting.
What's the recovery time for a flap patient? Once you remove, you know, they're recovering from cancer, or they're recovering from the implants out, and then you do the operation. What's the recovery? Like, does it take a long time to recover?
Yeah, that's a great question, Laura, and it's probably the most important question of the day.
Yes.
And here's the answer. You know, first, we can actually do the procedure on the same day as the mastectomy. So that's a huge benefit to the patient. where they're getting their cancer treated by a breast surgeon who specializes in breast reconstruction, breast cancer. And at the same time that the breast surgeon is working on the breast, I'm working on the abdomen to prepare the tissue. Then the breast surgeon will leave the operating room and I will complete the operation all in one day. So we can do it all at the same time, and it's a really great benefit for the patient. And when we do it that way, the surgery usually takes about 4 hours per side. We keep the patient in the hospital for 3 days, and the recovery is about 3 weeks at home and not being able to go to work. And the reason for that is there are 2 surgical sites. One is the breast and one is the abdomen. So there's a significant amount of recovery associated with this operation, but it's really worth it in the end because you get a completely natural reconstruction, and don't forget, you get a tummy tuck too.
Of course. And what about the patients who has this, I think it is called the brag, the one that Angelina Jolie did it because she thought she was like having that gene from her mom. Does this work from this kind of patients?
That's right. So yes, absolutely. So you're talking about the BRCA gene, BRCA. There's a few genes now that we recognize in medicine as being associated with the development of breast cancer. So we could just call it genetic predisposition to developing the disease. As I mentioned, there are quite a few genes now above and beyond just BRCA. And what we see now, because genetic counseling and genetic testing is so much more available than it ever used to be, we do see many more patients who are facing this very difficult decision. They don't actually have breast cancer yet, but they have a very high chance of getting it. And so how do we treat it? Often those patients are younger, like less than 40, and often those patients choose to have not one, but both of their breasts removed. And obviously you would remove both if you're having genetic predisposition to the disease. So in those cases, yes, we can reconstruct with using the DIEP flap or this lower abdominal skin flap.
I'm interviewing Dr. Singh. He's a chief of plastic surgery at the University of Miami Health System and a professor of surgery in the Division of Plastic Surgery at the University of Miami Miller School of Medicine. You can call for your appointment, and I'm gonna give your number, but I have another question, but I wanted to remind people to make an appointment with you, 305-243-7500, or what they call now telemedicine, because now we're doing this at home, so you can have a virtual visit with him. I want to ask you something, doctor, about, because I'm a fan, and I'm gonna confess something here. I'm a fan of the disaster surgeries kind of shows. That way, yeah, that botch, those kind of, because that way I see the disasters of, doctors who are not doctors, and I don't run myself, to visit a doctor who's not in the surgery. That's why it's very important for me to have you guys here in Chicanol. Some people can see what a real doctor is from a real, plastic surgeon, because for me, it's like, oh my God, how people go through those, it's horrible. But I'm asking that because I've been seeing a lot about the pectoral, implants, and I want you to really explain to me what's a pre-pectoral breast reconstruction with implants, so people can understand that.
Look, thank you so much for asking that question. I also watch Botched all the time. I can't take my eyes off of it. And I also do help a lot of patients who have been botched. I fast
forward the operation room. I fast forward, but I see that before.
So, Laura, thanks for the question about this issue of prepectoral or subpectoral implants. And basically what we're talking about is whether your implant, which is made out of a silicone gel, will go under a muscle in your chest called the pectoral muscle. It's the push-up muscle, or whether it's going to go over. And plastic surgeons over the years have gone back and forth about what the right location is. And I want to be clear, there's no right answer. There are just pros and cons to each approach. I personally strongly favor above the muscle or pre-pectoral. That's what pre-pectoral means, which is above the muscle. And there are a couple of reasons for that. In particular, with breast reconstruction, not cosmetic enhancement of the breast, but breast reconstruction, the patient, when I walk into the operating room after the mastectomy, will have very thin breast skin remaining. It's paper thin skin, that's what I get. And that paper thin skin has to be usually expanded in order to make enough skin to accommodate the size of an implant. And so in the past, we would put these water balloons under the muscle and stretch the muscle out. But I have to tell you, that causes a lot of pain. A lot of spasm, a lot of pain, stretching the muscle out. And so recently, in the last 5 years, we have newer implants that allow us to go above the muscle and not cause significant rippling that you would see traditionally with a saline implant and an implant that used to be just under the skin. You would see a lot of rippling. In other words, it's because of improvements in implant technology that we can go above the muscle and not see the rippling that we used to see through the remaining thin skin. So our implants are much better. And what does that mean? That means there's much less pain, no spasm, you're not stretching your muscle, and the implants don't move on the chest, which is something we call animation. When you go under the muscle and you activate your pectoral muscle, the implants can move up and down on the chest. And that may or may not be attractive in a male bodybuilder, but it's never something a female wants, to have their breast move up and down because the muscle is pulling the implant up and down. So those are all the reasons why I really strongly prefer to go above the muscle these days.
So Dr. Singh is a nationally recognized physician leader with a proven record of success in plastic and microvascular surgery. He specializes in breast reconstruction, including the microvascular flap procedure, which requires highly specialized training, guys. So thank you so much, doctor, for your time. If people want to make an appointment with you, 305-243-7500, and I'm going to be sharing this all over internet, you know, social media, and all your contact info. Thank you so much, because I think you're a light of hope for cancer survivors, doctor. Thank you so much for your work.
Thank you, Laura. Great to be with you.
Thank you.